Well, and when people have to decide, do I pay for, I'm well now, do I pay for maintenance versus paying for groceries versus paying for my insurance on my house or my property taxes? They have to make tough choices, right, about that. And I think that's a huge thing. There were some other issues in this bill that I know you and I have discussed before that I think are critically important for us to keep tabs on. The policy issues that have been pulled out, but like you said, they're not gone. They're not dead. This is what this administration wants to have happen. You want to address a couple of those?
Nonetheless, even if they stay in this bill, and the parliamentarian says, yes, these are budgetary, the budgetary issues are really the ones that are the most concerning, because it can shut down healthcare so readily, especially in South Dakota, and the chronically ill, the children, so many, I'm trying to think, how a huge proportion of the children in South Dakota are covered by Medicaid.
Yes, it is. It's
I think it's like 40%. It's big.
It's a very large proportion.
So if we don't take care of our kids, then they're not going to be successful adults that pay the taxes and go into the professions to take care of us when we get older. But it is distressing that the concerns I had as a bedside critical care nurse in the 80s, where I took care of patients that had strokes because they didn't take their medication because they had to choose between the gas bill or the rent or their medication. And we have not moved very far off of that. And that is really a concern. The Medicaid program is a wonderful support system. The last thing we want to do is to go out there and cut it. And the last thing we also want to do is destroy people's access to outside, because health, and I'm a nurse, I've not had an education to be a physician, but as a nurse, it's body, mind, spirit. And they are inextricably linked. And if you can't take care of your spirit, your body isn't going to do well. And if you're not mentally stable, your body's not going to do well, and your spirit's not. They're all hooked together. And with that, we need to be able to be out in nature. And I'm very concerned with the addressing of public lands and how they're at risk to be turned into opportunity for someone to make money, and that's all that's about. That's all that's about. So people need wilderness time, they need outside time, and they need a support.
Clean water, clean air.
Well, yeah,
those things too,
there's
right?
water.
And there are those issues, and those are all part of, like you said, the complete person, the whole person, keeping people healthy for the future. This bill does not do that.
Does not do that.
It helps the rich, and it makes our deficit bigger, and that's just not where we want to see.
It seems like a very inappropriate allocation of our resources and we are really, since the Great Depression of the 30s, the disparity of wealth is the greatest it's ever been. So we have less people with more money. They have more of the wealth of this country in a smaller cluster, than they have more money than ever, and that does not make for a productive, healthy, whether it's physically, financially, or mentally. It doesn't work. Does not work.